my name is Shauna. I'm going to be your student nurse today. And the doctor has some orders that I'm going to go ahead and help you out with. But first, if I may, can I go ahead and ask for your name and your date of birth?
Mary Foley, 6/14/35.
Thank you so much, Miss Foley. And can I go ahead and ask, do you have any allergies?
I'm allergic to aspirin.
All right, let me go and take a look. Thank you so much. The good news is today we're not doing anything with aspirin. What the doctor has ordered today, we're going to go ahead and take care of your central line. I did notice here that it's been a week since we've changed out your central line. So what I'm going to go ahead and do is I'm going to go ahead and remove your bandages, and I'm going to go ahead and clean everything up, and we're going to go ahead and put new bandages on for you today, okay?
Okay.
How's everything feeling so far?
It's feeling fine.
Okay. The good news is I'm not seeing any type of redness. I'm just doing a quick assessment and taking a look at everything. There's no puffiness, there's no redness, there's no heat, so it looks good. If you don't mind, I'm going to go ahead and step out of the room, and I'm going to go ahead and gather all my supplies, and I'm going to come right back, okay?
Okay.
All right, thank you so much. All right, so for the dressing change, what I'm going to have today, I do have my hand sanitizer. I'm going to also have some alcohol wipes. I'm going to have the Kuros cap. I'm going to have some positive pressure lumens. We're going to go ahead and have some normal salines. I've already squirted all the water out of these itself since we're not going to squirt anything in the...
Why do you have 3 of them?
We have 3 of each of these because we do have 3 lines that we are going to have to change. So we have to make sure we have enough supplies for everything. I have my gloves, and then I also have my kit. Now in my kit, what I'm going to go ahead and have in here is I'm going to go ahead and have my Tagaderm. I'm going to go ahead and have my Bio Patch. I'm going to go ahead and have my ChloraPrep. I'm going to go ahead and have some Skin Prep. I'm going to go ahead and have a gauze. This is going to be my drape. I've got a pair of sterile gloves and 2 masks, one for me and one for the patient.
So is that your sterile dressing kit?
This is my sterile dressing kit. I've collected the articles and now I'm ready to do the procedure.
Okay. So you're first opening one end of the sterile pack and just taking the mask out. I have 2 masks, one for the patient and one for myself. And the patient can turn her head if she wants to. Assessing the site for any redness, swelling, inflammations, anything abnormal, any discharge. So it's looking good. And taking the old dressing off. Take it off. First taking the edges off. All the while making sure that you're not pulling the central line off, so you're holding it down. And then finally can take the whole thing off along the line of the catheter and discard the old dressing along with the gloves. So the site still is looking good. Okay, going to wash my hands. I'm going to keep my flushes ready by expelling the air and loosening the top. I also have so now I'm going to open my sterile pack all the way and drop in the positive pressure valves that I will need after I put in the dressing, making sure that I don't touch the sterile pack because I'm not gloved yet. So now I'm going to take the drape, take the gloves off, the glove packet off, keep it on the side, take the drape and put it holding only at the edges, put it over so that you don't cover the area where you have to do the dressing. Okay, and then put the gloves on. Miss Foley, are you feeling okay?
I'm doing great. Thanks for asking.
All right.
My thumb got it. Well, we're gonna, it's sterile.
Okay.
I did it sterile.
Okay. So now I'm so while taking a so the I'm wearing the sterile gloves and then I'm taking the wrapper off. And now I'm taking the Chloropep and priming it by cracking it and pressing it against the palm so that it gets primed. And while cleaning it, I'm going to keep it right in the center first and then scrub vigorously. I'll take a gauze and hold the ends of the catheter, lift it up and clean underneath. So while holding this, if the gauze falls off, that's okay. I can still keep my left hand sterile. Okay, it's 30 seconds. And I'll discard the gloves. Discard the gauze and let it air dry. So I'm discarding that too. So after it is air dried, I will take my bio patch. So making sure that it's dropped into the sterile area, I'll pick the bio patch and place it along the line of the catheter, the blue side up. The blue side faces up. Okay, taking the skin prep. This helps the dressing to stick onto the skin well, so I'm using the skin prep. Let it air dry. and I'll take my Tegaderm and place it so that the bio patch is well inside the dressing. So when you press it from the center to the outside. And take the paper off. There's a label on that paper. So that has the date, time, and initial, date and initial on the label. So the dressing is neat and placed well. And now we have to flush the line and change the caps also. So flush the prime the positive pressure valve with the 10cc syringe or 10cc flush, and after priming, hold that in the left hand, in the other arm, and take off the old cap, old valve. Make sure that it is clamped before you do that. So you'll discard the old clean it for 10 seconds. Briskly, and then flush the line, unclamp it. You can pull back 1 or 2 cc and then flush it with push and pause method. Are you feeling okay, Miss Foley?
Oh yes, I feel wonderful, thank you.
Okay. So clamp it and then remove the syringe. And if you have Curos, if it is hospital policy, you can put the Curos onto it before you're placing it down. So repeat the same procedure with 2 different flushes on the 2 other lines. So you're feeling good, Miss Foley? Any questions? You did great.
I think I'm okay. Can I take my mask off now?
Absolutely.
Thank
Okay.
you.
There we go. And I'm going to take my mask off as well. I'm going to take my gloves off.
And use clean, wash your hands.
I'm going to go ahead and wash my hands. And what I'm going to go ahead and do, I'm going to go ahead and document that I did a central line dressing change, that's been done and completed, that I also placed a new bio patch on my patient. I'm going to go ahead and document the blood return if it was brisk or sluggish. I'm going to go ahead and flush the line, notate that I flushed the lines with 30 mLs of normal saline. I'm going to also document the patient comfortable after procedure.
Okay, and so date, time, and signature.
And date, time, and signature on my patient, and I'm going to go ahead and, I need to, and I'm going to clean up my mess.
Okay.
All right, Mrs. Foley, that's done. You did great. Do you have any questions?
No, not that I can think of.
All right. Well, you're all taken care of. If you have any questions, your call light is right here.